and I can't imagine like having it the traditional method after having it like the way that you perform a surgery. Like this is a world of difference from the last incision that I had. Like it's amazing.
Now, I'm considering about how do you feel?
I feel great. Like I've had back surgery before and it was nothing like this. Like I feel capable of moving. I was able to move mainly unassisted by the hospital staff. They were shocked that I could move so well, and I feel really good.
Yeah. Now, the last surgery was a laminectomy.
Yes.
And that was when?
2017.
So 3 years ago, and you were, how much did you weigh then?
Around 400 pounds.
And now you're about 500.
Yeah.
So your BMI is 62.5.
Yeah.
So, and you have to come a long way to Minnesota to get this surgery done.
Yeah.
Why?
Because the surgeons in Ohio just wouldn't do it. They said I was too overweight and told me to just lose weight and come back. And I was pretty much paralyzed, like so I couldn't lose the weight. So I came here to Minneapolis, and it was well worth the trip.
Yeah. No, the surgery just was yesterday.
Yeah.
And we did that surgery in 1 hour and 55 minutes. We did L2 to S1 OLLIF procedure, transcambient fusion, and before the surgery, now our surgery, we lost only 50 cc of blood, and my part was less than 2 hours.
Nice.
You know, it was a bit of, how was your day today?
Oh, it was good. I ate breakfast, lunch, and dinner. Quality-wise, feel good.
Did you go for a walk?
I did. I walked like 5 different times today, and immediately I was nervous that first time, and
yeah, it feels different.
It does, but nothing like it was way better than what I thought it was. I thought it was going to be much worse, and it wasn't that bad at all.
Before the surgery, you had leg pain. Where was it?
It was in my left lane, and go all the way down my left lane.
Yeah, to the foot or where?
All the way to my big toe.
Your big toe?
Yeah.
Not the back pain. How is that pain that was going down the leg?
It's gone.
It's gone.
It's completely like, not even, and it even feels, even my leg strength feels stronger today.
Yeah. Well, we opened up this space by putting those spacers, and we put 4 cages, 10 screws, 2 big rods.
Okay.
And from my side, actually, even though considering that we had to, because of your weight, we had to keep the tube in last night in the ICU so they can breathe you.
Right.
That has less to do with my procedure than, you know, the idea that we have to just make sure your lung get enough blood by laying just on that, even for 2 hours.
Right.
But they took the tube out, was no problem.
Yeah.
Besides that, I would have let you go home today.
Right.
But I'm just going to keep you over the night. And do you feel ready to go out of hospital?
I feel like I could be at home or in the hotel. Yeah, definitely.
Unfortunately, in the United States and globally, this is we weigh risk versus benefit. And the open old-fashioned surgery is a no-no.
Yeah.
Even after 2 hours being on your chest, we had difficulty breathing you, putting air in. In the open old-fashioned surgery, that would have been an 8, 7, 10-hour surgery.
Yeah.
Laying on that chest for that long, that would have been a very risky, extremely risky surgery.
Right.
So those surgeons in Ohio, they was doing the safe thing for you.
Yeah.
But it's just that we do the surgery in such a different way that we made a 10-hour surgery, a 2-hour surgery, and the result is the leg pain is gone. You have walked. You're ready to go home. Even in this situation, 1 day after the surgery.
Yeah.
And that is my pride, is that we know how to teach it to other people to do that. Hopefully soon, people in your situation don't have to travel that long to get this care.
I certainly hope, and I can't imagine like having it the traditional method after having it like the way that you perform a surgery. Like this is a world of difference from the last incision that I had. Like it's amazing.
And considering that 1 day after the surgery you are actually able to go home, that is unimaginable.
And the last surgery I had, they kept me for 10 days.
So, and that wasn't even a fusion. That was just a laminectomy, which is considered smaller surgery than a fusion. Now we did a 4-level fusion, and well, you have been a great patient. Okay.
Thank you.
And it really pains me that in a situation like that, many patients in your situation are told, go lose weight and come back, because reality is when you are in pain, you cannot do anything. You are not going to lose weight. You are just going to gain weight.
Yeah.
And that is the reality of it. Sometimes we surgeons, we make it easy on ourselves.
Right.
We just want you to go away because it's risky and we don't want to take that risk. and go lose weight and come back is just to get you out of the door.
Yeah, I honestly feel like I have a new lease on life, and now I can actually go lose weight. So thank you.
Yeah. Well, thank you so much. Okay, I appreciate this.